Welcome, dear friends, viewers, and my colleagues. Welcome on MuniMeterHealth. This is Dr. Jaitly, your cardiologist from New York, coming up with another new subject this video. How does nitroglycerin or the nitrates work? Well, before we delve into the subject matter, my quick housekeeping rules. Number one, if you're experiencing an emergency, please get to the nearest doctor, nearest hospital right away. Two, for my students, residents, and fellows, the valued ones, I certainly say that please consider this as a supplement and not a substitute to your syllabus. And three, it's not a medical advice channel. It is purely a medical education channel because we believe in medical education and patient education at large. So this way we can improve the clinical outcomes in our patients, and that's our global initiative. So welcome again on MuniMeterHealth. This is your subject today. How does nitroglycerin nitrates work? Well, as early as 1879 was the first time when actually it was shown by Dr. Muller, who demonstrated that the anginal episodes can actually be relieved. Angina pectoris, which was originally historically defined by Dr. Heberden, as you know, been chapters written about that. And just briefly, the angina pectoris in those years, obviously there was no existing EKGs, etc., and other testing that we have today. But the fact is that it was clinical diagnosis. In 1879, Dr. Murrell prescribed nitroglycerin to some of his patients, and they got better. Let's move fast forward and understand 100 years later what the mechanism of action of nitroglycerin, which we now have been able to understand it better. Well, there are sulfahydryl groups which are present within the vasomotor cells, and these vasomotor cells, they are present where? They are present in the veins, they are present in the coronaries, and they are present in the arterioles. Now, the sulfahydryl groups, they will attach to the enzyme called ALDH2. And that's a long name. Just remember, ALDH2 is present within the vasomotor cells. So the nitroglycerin will interact with the sulfahydryl groups and cause vasodilatation here, and a vasodilatation in the arterial system, especially in higher doses. Because remember, in modest doses, it will not work on the arterial system, but predominantly it will work on the venous and the coronaries right away. So having understood that, this is the mechanism of action where it works. Now, systemically, basically, it is a vasodilator. So because it vasodilates, it causes blood pressure drop, obviously. It'll also reduce the venous return. So the venous return gets reduced. So as a result, the right ventricular end diastolic pressures will decline. Left ventricular end diastolic pressures will also decline. Why? Because it's the same vasodilator action happening there as well. And moreover, what will happen is the systemic vascular resistance will also decline. So what will happen is the cardiac output, on the contrary, should increase, because remember, the more the resistance, the lesser is the cardiac output. So the cardiac output will increase. Blood pressure as a whole, the systemic blood pressure will decline. So this is the hemodynamics where it works on. So now if you were to draw the schematics, which I will now, and if you look at the heart, for instance, this color, here's the right atrium and the right ventricle, and the left atrium and the left ventricle, just for your sake. So the left ventricle will actually, LV-EDP will drop, as you know. Cardiac output will increase because the systemic vascular resistance will drop. So the afterload reduction has occurred. Afterload reduction, we'll call it afterload reduction. Preload reduction is occurring here. So the preload reduction is occurring here. Why? Because the venous return is declining. So the venous return that's coming on the right atrium side, that is also declining. So in general, it's a preload reducer. In higher doses, it's also an afterload reducer, as you see. And both these actions hemodynamically are desirably used to treat our anginal patients. So you can treat these patients predominantly for unstable angina, chronic stable angina, if you will, okay? And then you can use even for chronic heart failure as well as for acute heart failures, because remember, acute heart failure, they'll work wonderfully because intravenously, if you were to use, you can reduce the RV-EDP and LV-EDP right away. So this way, the acute pulmonary edema also resolves rather quick. So IV nitroglycerin has been the mode of approach in acute heart failure settings. In topical settings, you can use it for unstable angina or chronic stable angina, and in chronic heart failures. And mostly it's given as either topical or oral. Remember, because it's a vasodilator, it will also vasodilate the meningeal arteries, and because it does that, it causes headaches as the side effect. That's the major side effect, and the drop in blood pressure is the other side effect. Remember, so headaches and blood pressure drop, these are, so in elderly population, use it very, very cautiously, folks. It's very, very important. Now remember that it can be used topical, as I said, it could be used orally, or it could be used intravenously. Now topically, it comes in a dose where it's 0.2 milligrams per hour to be delivered. Now you have to take 12 to 14 hours, remember, take the patch off, because nitrate tolerance develops if you leave it on for 24 hours. So remember that. So that's an important part. Orally, again, it can be given as 10 milligrams TID of 3 times a day of isosorbide dinitrate. I'm writing it down here for you, DN, and isosorbide mononitrate, if you will. And IV nitroglycerin, of course, can be used for acute heart failure settings and acute hypertensive crisis, etc. So it has multiple uses. But do not forget the sublingual use. And I always say, don't leave home without it to my anginal patients, because it's like your American Express. You got to carry it with you, just in case if you're experiencing angina while walking in the mall, or taking up a flight of stairs, or playing tennis, or whatever else they are involved in physical activity during the day. A sublingual nitroglycerin immediately takes care of your angina instantly, as long as it's medicated as advised. Okay, so in a nutshell, you've learned about how nitroglycerin works, and obviously they are also called nitrates. So they come in different, in summary, they basically hemodynamically reduce the LV-EDP and RV-EDP, and as a result, these patients benefit both by afterload reduction as well as preload reduction, which is predominant, and then the coronary vasodilatation, which we talked about anyway, because that's where the oxygen demand is met. So oxygen supply is met by coronary vasodilatation, and oxygen demand is reduced by reduction of LV-EDP. Remember, when it reduces LV-EDP, it's also reducing the wall stress, and we call it the wall stress here, the left ventricular wall stress. We'll write it down for you here. So this wall stress is also reduced in these patients, and because it's reduced, the oxygen demand is also reduced in these patients as a result. Okay, so in summary, you've learned something about nitroglycerin today. It's a